Well, there's growing evidence that this disease is not just binary. It's not just about whether you die or whether you survive. In fact, there was a study that was published in The Lancet that looked at patients who had recovered from hospitalization in Wuhan, China. 6 months later, they had at least one lingering symptom. And that is a remarkable statistic to say that 6 months later, oh, by the way, it was 3/4 of the patients. I failed to mention that. So let me kind of reiterate altogether. The study published in Lancet looked at Chinese patients who were hospitalized in Wuhan, China. Of that group, 3/4 of them had at least one lingering symptom now 6 months post-infection. So this is not a disease you want to get if you don't have to. Even if you recover from it and say, hey, that wasn't that bad of an illness, there's no telling how long the remaining symptoms will last, including your ability to smell, your ability to taste, maybe difficulty breathing, maybe lingering fatigue. You don't want to get this illness. So then on the corollary, why should you get this vaccine? Well, we have more and more evidence that shows that it's remarkably safe. A CDC report analyzed the adverse event reporting system. It's called VAERS, or Vaccine Adverse Reporting System. Now that we've given almost 2 million doses of the Pfizer vaccine, there's only 21 cases of anaphylaxis. That is a remarkably safe number. So the vaccine is safe. Now the question becomes, is it effective? Well, we had really good data in the clinical trials about efficacy, and now we have this new strain that's come about in South Africa and the United Kingdom. Well, they went with the University of Texas Medical Branch and analyzed the Pfizer vaccine in a laboratory, and the Pfizer vaccine was shown to be effective in the lab against these new strains. I suspect the Moderna will have similar results when it's studied. So we have a disease you don't want to get for multiple reasons. One being your own personal health and what it means for you 6 months down the road. Secondarily, you don't want to spread this to more vulnerable people. Well, that's more the public health play that we've been talking about for a long time. And then on the other hand, you have a vaccine that is not only safe, but it's effective, and the immunity can last months. We now have a study that showed that people that recover from this illness have at least 8 months of lasting immunity. That came from a study published in Science. And we also have earlier studies that showed the antibody response in people that get the vaccine is actually higher than the people that got the actual illness. So for that reason, the CDC is stressing that even if you got COVID-19, they still want you to get the vaccine. Maybe not right away, but nevertheless, when it's your turn, when it comes up and it's available to you, the CDC is recommending that you go ahead and get the vaccine, because we know the vaccine generates an even greater immune response. So this could be a one and done deal with this vaccine if mutations aren't significant, and we know it's safe. And oh, by the way, you don't want to get this illness. So for those reasons, I would say get the vaccine. Please avoid getting this illness if you can.